problems.
It's a great pleasure to be a participant of this conference as a speaker. And I would like to tell that now I am present in Kharkiv. And 1 year ago, we created a regional Kharkiv program for pediatrics palliative care. And in Ukraine, the pediatrics palliative care is in development, and about before, in previous war period, about 500 and 700 children need in this kind of support. 1 year ago, we created the volunteer group for family with boys with DMD. In our volunteer group, we include the physical therapist, ergotherapist, some medical specialists. For what reason we made it? Because we understand that our medical society don't know about evidence-based approach for treatment and supporting of this family. And we start to create a volunteer group about this family, and some families we supported by Zoom, by virtual, in other regions of Ukraine. I would like to tell that there is a young boy, George. He lives in Kharkiv and now, and this boy has body weight more than 100 kg, and he has a mother and grandma in age 65 plus, and he has no any social support about psychosocial support, about working, about young man needs, and with cooperation of parental organization of DMD in Ukraine, we create the respiratory mechanical ventilation support and other supports for this boy. During shelling, during bombing in Kharkiv, George was afraid, but we understand that many people were refugees, and we continue to support him. He lives in 4th floor, and unfortunately he had no opportunity to be in selling during bombing. 24 February destroyed all medical logistic in Ukraine, especially in our region, and as many families with DMD, with boys with DMD, were refugees. Many families stay in Kharkiv, and some families were in occupied territory by Russian army, and we know that some boys and family has no approach to the medicine, pharmacy, sometimes food, and now we destroyed connection with this family. Our vision of the difficulties in previous period, not only in pediatrics palliative care, and of course in, for example, in approach for DMD treatment, and first of all, it's acute storage qualified medical personnel, insufficiency of educational programs, and lack of opportunities to study best practice in this field in native Ukrainian language, inadequacy of coordination between primary, secondary, tertiary levels of medical care, and of course, no coordination between social support and medical support. No any interdisciplinary coordination. Absence of the state of policy in pediatrics palliative care, and no any programs and monitoring, and of course, as example, there is some problem about nutritional. We know that there is a European Society of Pediatrics, Gastroenterology, Hematology, and Nutrition guidelines for nutritional support of patients with neurological impairments, especially DMD. But now we have massive humanitarian aid availability, various clinical nutrition formulas, but we have no opportunity to put gastrostomy, and our personal staff, medical staff, don't know about prescribing of this clinical nutritional. It's a lack, for example, it's a small example about educational. Of course, we have no any calculation of pediatrics palliative care needs before war, and now it's impossible due to refugees, due to situation of humanitarian crisis, and we have no any basic educational program and have no specialist in pediatrics palliative care for families who have children with life-limiting and life-threatening diseases. Our country is in Russian aggression now, and of course, we have society no English speaking. I would like to show you our search from Google about some key words: palliative care in war, palliative care in humanitarian crisis, but there are no any document, no any guidelines for such in Ukrainian language. That's why it's also difficult to support some families. Our vision in post-war period, of course, we hope on victory because many countries support us, and of course, first of all, we may create regulatory legislative framework. We must create coordination centers, departments of palliative medicine in medical colleges, in universities, and of course, some programs must be in developmental and networking. Creation a system of reimbursement of the cost of medicine and medical devices. Creation a system of financing and monitoring of this financing as fundraising, for example, some government support, and we must start educate medical staff of basic principle of pediatrics palliative center. Of course, some educational problems must be as concealed because integration, we need integration in progressive countries in cooperation with international care, pediatrics children network, pool chairs, other medical societies in palliative care. We need, for example, in educational program, we need in advocacy of specialists in pediatrics palliative care, and translation some guidelines, the textbooks in the pre-graduated and post-graduated level. Of course, creation of new international programs in humanitarian crisis of palliative care, and perform the monitoring group in our country. Thank you very much for my report, and I think our vision helps for supporting of patient with DMD that needs not only in medicine, but they needs in multidisciplinary team and especially in psychosocial support. Thank you very much.